Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Question 1. The nurse has just received shift report. Which client should the nurse assess first? A client with COPD whose oxygen saturation is 89% on home oxygen. B. A client with chest pain rated 8 out of 10 that began 10 minutes ago. C. A client requesting pain medication for chronic back pain. D. A client scheduled for discharge in 1 hour. Correct answer, B. A client with chest pain rated 8 out of 10 that began 10 minutes ago. Rationale. New-onset chest pain may indicate an acute myocardial infarction and requires immediate assessment using the ABCs and priority framework. Question 2. Which task is appropriate for the nurse to delegate to an unlicensed assistive personnel, UAP? A. Reinforce discharge teaching. B. Measure and record vital signs on a stable client. C. Assess a client's pain after medication. D. Administer oral medications. Correct answer, B. Measure and record vital signs on a stable client. Rationale. UAPs can perform routine tasks on stable clients. Assessment, teaching, and medication administration remain the nurse's responsibility. Question 3. The nurse is caring for 4 clients. Which client should be seen first? A client with a potassium level of 6.2 milliequivalent/L. B. A client requesting assistance to the bathroom. C. A client awaiting lunch. D. A client with chronic arthritis pain rated 4 out of 10. Correct answer, A. A client with a potassium level of 6.2 milliequivalent/L. Rationale. Severe hyperkalemia can cause life-threatening cardiac dysrhythmias and requires immediate intervention. Question 4. Which task can the nurse safely delegate to a licensed practical/vocational nurse, LPN/LVN? A. Perform the initial assessment of a newly admitted client. B. Administer routine oral medications to a stable client. C. Develop the nursing care plan. D. Provide discharge education. Correct answer, B. Administer routine oral medications to a stable client. Rationale. LPN/LVNs can administer routine medications and provide care for stable clients but cannot perform initial assessments or develop care plans. Question 5, SATA. Which tasks can be delegated to an unlicensed assistive personnel, UAP? Select all that apply. A. Assist a client with bathing. B. Obtain a blood glucose reading using a glucometer. C. Feed a client who has no swallowing difficulties. D. Assess lung sounds. E. Measure intake and output. Correct answers, A, B, C, E. Rationale. UAPs may assist with activities of daily living, obtain routine blood glucose readings, per facility policy, feed stable clients, and measure intake and output. Assessment is the nurse's responsibility. Question 6. A client suddenly becomes short of breath and restless after surgery. What should the nurse do first? A. Assess the client's airway, breathing, and oxygen saturation. B. Notify the healthcare provider. C. Document the findings. D. Administer pain medication. Correct answer, A. Assess the client's airway, breathing, and oxygen saturation. Rationale. Always assess first using the ABCs. Airway and breathing take priority. Question 7. The nurse receives the following laboratory results. Which result requires immediate follow-up? A. Sodium 138 milliequivalent/L. B. Potassium 2.8 milliequivalent/L. C. Calcium 9.2 milligrams per deciliter. D. Glucose 110 milligrams per deciliter. Correct answer, B. Potassium 2.8 milliequivalent/L. Rationale. Severe hypokalemia increases the risk of dangerous cardiac dysrhythmias and requires prompt intervention. Question 8. Which client should the nurse see first? A. A postoperative client with sudden confusion and oxygen saturation of 86%. B. A client requesting a blanket. C. A client asking about discharge instructions. D. A client with chronic constipation. Correct answer, A. A postoperative client with sudden confusion and oxygen saturation of 86%. Rationale: low oxygen saturation with acute mental status changes suggests impaired oxygenation and requires immediate assessment. Question 9. A registered nurse is supervising an LPN and a UAP. Which client should the RN care for? A. A stable client needing a dressing change. B. A newly admitted client requiring a comprehensive assessment. C. A stable client needing assistance with feeding. D. A client requiring routine vital signs. Correct answer, B. A newly admitted client requiring a comprehensive assessment. Rationale: initial assessments must be completed by the RN. Question 10, SATA. The nurse is using the ABC priority framework. Which client should be assessed immediately? Select all that apply. A. A client with stridor. B. A client with severe respiratory distress. C. A client with uncontrolled bleeding. D. A client with chest pain and diaphoresis. E. A client requesting a sleeping pill. Correct answers, A, B, C, D. Rationale: airway obstruction, breathing problems, circulation issues, and signs of acute coronary syndrome are life-threatening priorities. A request for a sleeping pill is not an immediate priority. Question 11. The nurse is caring for 4 clients. Which client should be assessed first? A. A client with pneumonia whose oxygen saturation has dropped from 95% to 88%. B. A client requesting assistance to the bathroom. C. A client who needs a dressing change. D. A client waiting for discharge paperwork. Correct answer, A. A client with pneumonia whose oxygen saturation has dropped from 95% to 88%. Rationale: a decrease in oxygen saturation indicates impaired breathing, making this the highest priority according to the ABCs. Question 12. Which task is appropriate for the nurse to delegate to an LPN/LVN? A. Assess a newly admitted client. B. Administer routine oral medications to a stable client. C. Develop the nursing care plan. D. Perform discharge teaching. Correct answer, B. Administer routine oral medications to a stable client. Rationale: LPN/LVNs can administer medications and care for stable clients but cannot perform initial assessments or discharge teaching. Question 13. A client one day after a thyroidectomy reports difficulty breathing. What should the nurse do first? A. Assess the airway. B. Notify the surgeon. C. Administer pain medication. D. Check the incision dressing. Correct answer, A. Assess the airway. Rationale: airway compromise is the highest priority after thyroid surgery because swelling or bleeding can obstruct the airway. Question 14. Which client should the nurse see first? A. A client with a blood glucose of 48 mg per deciliter who is awake and sweating. B. A client requesting a snack. C. A client awaiting a chest X-ray. D. A client complaining of chronic knee pain. Correct answer, A. A client with a blood glucose of 48 mg per deciliter who is awake and sweating. Rationale: severe hypoglycemia is a medical emergency and requires immediate treatment. Question 15, SATA. Which tasks may be delegated to an unlicensed assistive personnel, UAP? Select all that apply. A. Ambulate a stable postoperative client. B. Obtain routine vital signs. C. Assist with feeding a client without swallowing difficulties. D. Assess pain after medication administration. E. Collect a urine specimen. Correct answers, A, B, C, E. Rationale: UAPs can perform routine, non-assessment tasks. Pain assessment after medication administration is the nurse's responsibility. Question 16. The nurse receives these client reports. Which client should be seen first? A. A client with sudden onset of slurred speech and facial drooping. B. A client with constipation for 3 days. C. A client requesting a sleep aid. D. A client asking about tomorrow's surgery. Correct answer, A. A client with sudden onset of slurred speech and facial drooping. Rationale: these are signs of an acute stroke and require immediate assessment and intervention. Question 17. Which client assignment is most appropriate for an experienced LPN/LVN? A. A newly admitted client with chest pain. B. A stable client receiving routine wound care. C. A client requiring initial discharge teaching. D. A client with rapidly changing neurological status. Correct answer, B. A stable client receiving routine wound care. Rationale: LPN/LVN's care for stable clients with predictable outcomes. Question 18. The nurse is caring for 4 clients. Which client requires immediate intervention? A. A client with asthma who has audible wheezing and difficulty speaking. B. A client requesting pain medication. C. A client with a temperature of 99.5 degrees Fahrenheit 37.5 degrees Celsius. D. A client waiting for breakfast. Correct answer, A. A client with asthma who has audible wheezing and difficulty speaking. Rationale: difficulty speaking due to respiratory distress indicates a potentially life-threatening airway problem. Question 19. Which client should the nurse assess first after receiving report? A. A client with heart failure who suddenly develops pink, frothy sputum. B. A client with chronic back pain requesting medication. C. A client scheduled for physical therapy. D. A client asking for water. Correct answer, A. A client with heart failure who suddenly develops pink, frothy sputum. Rationale: pink, frothy sputum is a classic sign of acute pulmonary edema, requiring immediate intervention. Question 20, SATA. The nurse is deciding which tasks can be delegated to an LPN/LVN. Which tasks are appropriate? Select all that apply. A. Administer routine oral medications. B. Perform sterile dressing changes. C. Reinforce teaching that the RN has already provided. D. Perform the initial admission assessment. E. Monitor a stable client receiving IV therapy according to facility policy. Correct answers, A, B, C, E. Rationale: LPN/LVNs may administer medications, perform sterile procedures, reinforce teaching, and monitor stable clients. Initial assessments must be completed by the RN. Question 21. The nurse is caring for 4 clients. Which client should be assessed first? A. A client with sudden onset of stridor after surgery. B. A client requesting assistance with breakfast. C. A client awaiting discharge instructions. D. A client with chronic arthritis pain rated 5 out of 10. Correct answer, A. A client with sudden onset of stridor after surgery. Rationale: stridor indicates airway obstruction, making airway the highest priority, ABCs. Question 22. Which task is appropriate for the nurse to delegate to a UAP? A. Assist a stable client with ambulation. B. Assess bowel sounds after surgery. C. Teach a client how to use an incentive spirometer. D. Evaluate a client's pain after medication. Correct answer, A. Assist a stable client with ambulation. Rationale: ambulating stable clients is within the UAP scope. Assessment, teaching, and evaluation must be performed by the nurse. Question 23. A nurse receives these laboratory results. Which result requires immediate intervention? A. Potassium 6.5 milliequivalent/L. B. Sodium 136 milliequivalent/L. C. Calcium 9.4 milligrams per deciliter. D. Glucose 105 milligrams per deciliter. Correct answer, A. Potassium 6.5 milliequivalent/L. Rationale: severe hyperkalemia can cause fatal cardiac dysrhythmias and requires immediate treatment. Question 24. The nurse is caring for 4 clients. Which client should be seen first? A. A client with new confusion after receiving insulin. B. A client requesting a sleeping pill. C. A client waiting for lunch. D. A client with chronic low back pain. Correct answer, A. A client with new confusion after receiving insulin. Rationale: new confusion may indicate hypoglycemia, a potentially life-threatening emergency. Question 25, SATA. Which situations require the RN to intervene immediately? Select all that apply. A. A client with chest pain. B. A client with oxygen saturation of 84%. C. A client coughing up bright red blood. D. A client asking for a blanket. E. A client with sudden inability to speak. Correct answers, A, B, C, E. Rationale: chest pain, severe hypoxemia, hemoptysis, and sudden inability to speak are emergencies requiring immediate assessment. Question 26. Which client is appropriate to assign to an LPN/LVN? A. A stable postoperative client needing routine wound care. B. A newly admitted client with sepsis. C. A client requiring an initial neurological assessment. D. A client with rapidly deteriorating respiratory status. Correct answer, A. A stable postoperative client needing routine wound care. Rationale: LPN/LVN's care for stable clients with predictable outcomes. Question 27. A client suddenly becomes unresponsive while eating lunch. What is the nurse's first action? A. Assess the airway and responsiveness. B. Call the healthcare provider. C. Obtain vital signs. D. Complete an incident report. Correct answer, A. Assess the airway and responsiveness. Rationale: immediate assessment of airway and responsiveness is the priority before initiating further interventions. Question 28. Which client should the nurse assess first? A. A client with heart failure who reports sudden shortness of breath while lying flat. B. A client requesting a diet soda. C. A client needing assistance with bathing. D. A client asking for discharge paperwork. Correct answer, A. A client with heart failure who reports sudden shortness of breath while lying flat. Rationale: orthopnea and sudden dyspnea may indicate acute pulmonary edema and require immediate evaluation. Question 29. The nurse is assigning tasks to a UAP. Which task should not be delegated? A. Measuring intake and output. B. Feeding a client without swallowing problems. C. Collecting a urine specimen. D. Assessing a client's pain level after analgesic administration. Correct answer, D. Assessing a client's pain level after analgesic administration. Rationale: assessment and evaluation of a client's response to treatment must be performed by the nurse. Question 30, SATA. Which principles should the nurse use when prioritizing client care? Select all that apply. A. Airway, breathing, circulation, ABCs. B. Maslow's hierarchy of needs. C. Acute problems before chronic problems. D. Stable clients before unstable clients. E. Safety and risk reduction. Correct answers, A, B, C, E. Rationale: NCLEX prioritization is based on the ABCs, Maslow's hierarchy, acute before chronic conditions, and client safety. Unstable clients should always be prioritized before stable clients. Great job making it to the end. Comment your score out of 30 below. If this video helped you, don't forget to like, subscribe, and share it with a fellow nursing student. I'll see you in the next NCLEX practice session.